Please like, comment and subscribe. If you have any question, then write your question in the comment box. Good evening friends. Today we will discuss about how a woman can become pregnant. A woman can become pregnant by vaginal intercourse and she can also get pregnant by ejaculation of sperm right at the point of the opening of the vagina. Another way how to get pregnant without having intercourse is the process of in vitro fertilization. This process involves taking an egg from an ovary and fertilizing it in a lab with her partner's sperm and then placing the embryo into the woman's uterus. Fertility treatment helps when the woman is unable to conceive a baby with a natural process. For the best chance of getting pregnant, couple need to get her eggs and her partner's sperm together as often as possible. Regular unprotected sex every 2 to 3 days without using any contraception, it can prevent fertilization and a woman can become pregnant. Sperm can live up to 5 days and this means there will always be fresh sample sperm in woman's system when she ovulates. Ovulate means release of an egg. Now, how does pregnancy start? The cycle starts on the first day of period and continues up to first day of the next period. This is what happens during the cycle and the start of a pregnancy. Egg is mature in woman's ovaries once a month. The lining of womb start to get thicker to prepare for fertilized eggs. Once the egg is mature, it is released from one of the ovaries. This is called as ovulation. During ovulation, cervical mucus becomes thinner and clearer to help any sperm to swim to the egg. If a person having sex means the person of sperm will swim up to the cervix into the uterus and the fallopian tubes to meet a mature egg. If sperm is present at the point of ovulation or during the next 24 hours, the egg may be fertilized. If the egg is fertilized, it starts to move towards the womb and divides into more cells. Once it reaches the womb, the fertilized egg has to attach to the lining of the womb. This is known as implantation and it is the start of pregnancy. Many fertilized eggs don't implant and are passed out of the body. If the egg has not been fertilized, the egg is being released by the body hormone. Hormone level drops and the womb lining is shed at the beginning of her next period. If woman knows when she has ovulated each month, then she can give herself the best chance of getting pregnant by having a sex in the days leading up to ovulation. What is the age to get pregnant? For the woman, easiest time to get pregnant is after 20 years and before 30 years. As women get older, it takes longer time to conceive and the chance of having a baby decreases. As the age increases, the quality of egg is decreased. Normal pregnancy can range from 38 to 40 weeks. Infants born before 37 weeks are considered premature. Infants born after 42 weeks are considered post-mature. In some cases, doctor suggests to do cesarean because it happens when a woman who is giving a birth to the baby a first time, if she is having a labor pain for 20 hours or more, or women who is giving birth second time to the baby, if she is having 14 hours or more than the labor pain, babies are too large for the birth canal, slow cervical thinning and carrying multiples can all prolong labor. In these cases, doctors consider a cesarean to avoid complications. The woman get most likely to become pregnant if she had sex within a day or so of ovulation. This is usually about 14 days after the first day of her last period. If her cycle is around 28 days long, and eggs can live about for 24 hours after being released. Now, I will tell you about at what age the menopause occurs. Menopause can happen in 40s to 50s, but the average age is 51. There are three phases of menopause. First is the transition, in which include perimenopause. In this condition, a woman's body begins the transition. Second is menopause, when she have experienced 12 consecutive months without a menstrual period. And the third one is post-menopause. In this condition, generally 24 to 36 months after her last period, when her symptoms begin to subside. Thank you.